Big story back in April when 2,400 CDC employees lost their jobs, and then 2 months later, 400 of them got their job reinstated. But among those federal cuts were the people responsible for drowning prevention. So Danny Spiewak explains how that is impacting a local group now that swimming season is out in full swing.
We're going to start at 8 o'clock.
In White Bear Lake on Tuesday, the organization Abby's Hope donated its 10,000th life jacket.
I didn't really think my lot in life was going to be working on water safety.
Part of an effort by Scott and Katie Taylor to honor the memory of their daughter, Abby, who died in 2008 after an accident at a public pool.
Something to celebrate her life and to help others.
Abby's Hope also has a charitable foundation led by Alan Korn in Washington, D.C.
Part of the component of addressing injury prevention is public policy.
Korn says he's deeply concerned by federal cuts to the CDC's Injury Prevention Center this April that included a drowning prevention team. What type of impact does that have on your organization?
That's had quite a negative effect on drowning prevention. We at Abby's Hope and a lot of other water safety stakeholders relied on that injury prevention center for surveillance, for research related to drowning, how, when, where.
In all, the Injury Prevention Center lost 200 employees, according to Sharon Gilmartin,
which is about a third of their staff.
She leads the Safe States Alliance, which works directly with the CDC to prevent injuries like drowning, car crashes, suicide, and overdose prevention.
We have a lot at stake. It's our community safety that is hanging in the threads here.
The layoffs at the CDC's Injury Prevention Center were part of broader Health and Human Services layoffs under Secretary Robert F. Kennedy Jr. In a statement to KARE 11, HHS said critical CDC programs will continue as a part of Secretary Kennedy's vision to streamline HHS to better serve the American people. Kennedy has said as much himself.
We have two goals. The first is obvious, to save the taxpayer money by making our department more efficient. And the second is to radically improve our quality of service.
On drowning prevention specifically, HHS says it will continue to support evidence-based drowning prevention efforts across the country. But groups like Abby's Hope say cuts to the CDC drowning prevention team will hurt.
Without them, we're going to have to fill the void with some other way.
The cuts at Health and Human Services are related to Secretary Kennedy's goal to, quote, make America healthy again. He has defended restructuring as a way to both improve health and devote more resources to chronic diseases. Danny Spiewak, KARE 11 News.